Thanks for joining us on News 25 for a brand new expert talk. This week, we have Dr. Stanford Owen with the ADD Clinic talking about ADD and marijuana. Dr. Owen, thanks for joining us today.
Thanks for having me.
Of course. Well, tell me a little bit about daily use of marijuana versus occasional use of marijuana when it comes to someone with ADD.
So marijuana contains THC and CBDs, and those are fat-soluble chemicals. And so when you smoke or ingest marijuana, it goes not only to the bloodstream, but it goes to the brain, and the brain is mostly fat.
Right.
So it stays in the brain and it accumulates in the brain. And so daily use, you're gonna find progressive accumulation of marijuana in the brain that may take 6 weeks, 8 weeks, several months to clean out of the brain.
Okay.
Daily use, you may seem like you have none in your system 2 or 3 or 4 days later, but you can actually still have marijuana in the brain. So it's a dulling, slowing drug. It slows the brain down. It makes you more sluggish. You can hear it in the voice, and people take it every day.
Right.
And that's not good if you really want a sharp, active, precise, on-point brain.
Okay.
One of the things that is discussed now is that it's medicinal, which means it's prescribed and you can actually get a prescription for it. The question is, what are you treating? And most of the time it's a psychiatric anxiety, depression, PTSD, worry, things like that. Occasionally just to relax like people do with a beer. But for the most part, people using it daily are sedating themselves.
Do you have any other risks to let people know about when it comes to marijuana use and ADD?
Well, you can become addicted to it. It's called marijuana use syndrome, and it can cause weight loss and chronic vomiting and headaches. And the most important thing is it causes anger.
Okay.
So especially when it's starting to wear down, anger becomes a predominant component. So if you have somebody in the family that seems to be angry a lot, ask if they're smoking marijuana.
Okay.
It affects the temporal lobe of the brain, which is where the anger center is suppressed.
All right, a lot of great information. Thank you for that, Dr. Owen.
All right.
And thank you for joining us on this week's Expert Talk.